This mentorship hour focused on contraindications, from rosacea to psoriasis to pacemakers, diabetes, and the impact of medications. We discussed safety, screening, and documentation. Good evening, everyone. Welcome to this week's mentorship hour.
So I know that we had a couple great questions come through from one of our mentos.
That's right. It kind of kicks off with, can you perform blend on diabetic type 1 that has to wear insulin sensors, pumps, like a Dexcom, for example? So let's kind of kick it off with what exactly is the contraindication when it comes to diabetes, right?
Yeah. I mean, it really comes down to skin healing above anything else. It's just those with diabetes tend to have a much slower response in the skin healing. And so therefore we have to just take our time to get to know the skin.
Most of the time, I mean, it really has nothing to do with the pump itself or the medicine, but it's the fact that if insulin levels are elevated in your bloodstream, it actually makes it so that you are unable to heal as well as somebody that does not have elevated insulin. So technically, when it comes to diabetes, it's usually as long as the diabetes is under control, so their insulin levels are, within normal range, then doing treatment is not an issue. But if the client has a hard time or insulin levels are kind of all over the place because of insert reason here, really, that's kind of between them and their doctor, I guess, then it becomes a problem, right? So insulin levels that are too high in the blood means that they can get wounds and wounds won't heal as well. It can fester. And that's where you have people with these like lower limb wounds that don't heal and then ends up with amputations and things like that.
The only thing we want to amputate is a hair at this point. I mean, but that you brought up something kind of like that's a good point. When it comes to getting to know whether or not a patient's body can handle something or they should be doing something, when there is a question, especially when the patient is leading the question, okay, where they're really concerned on their end, it's just important to take that moment to say, okay, here are my machine stats. I'm going to have you bring this back to your doctor. And I want you to show this to them and say that you're going through electrolysis treatments. Be very forthcoming with that, because guess what? You may be experiencing some of these side effects with hirsutism or hypertrichosis being more elevated in these spaces because insulin levels are out of control. And so it becomes a greater conversation to have with your doctor. And in most cases, docs are like, yeah, I mean, informed consent, do what you need to do to be healthy, because most devices aren't going to, when it comes to diabetes, aren't going to be impacted negatively. Now, the Dexcom, that is an interesting one that was brought up because it is using Bluetooth connectivity to work. And so, and I'm not currently using Dexcom, but my spouse does. And so I will tell you that if you interrupt the Bluetooth, which is not on the same frequency, but like it will start screaming in the middle of a session, which is very disconcerting, because yesterday we had that happening in our household where it was just going off over and over again because it was having a glitch. And at 1, 2, 3 a.m. where it's just like, and there's like, it's one of those.
You got, honey, Katie.
Haha, gotcha. Yeah, Katie. So that is part of it. So I would say that it's important to test the theory and talk to their doctor, have them talk to their doctor about it, and just get a doctor's note in those moments. I haven't seen it glitch out due to electrolysis, because often if somebody cancels out, I'm like, Mike, they'll get stabbed by the students until it's not stabbing anymore. And his favorite pastime. But it hasn't been a negative impact for him at all. So I can say anecdotally.
Yeah, well, that's good. I mean, and then also there's considerations as far as if we know that they are healing compromised, then we have to talk about how to stress the aftercare and the home care. So, for example, we know that some of these wounds that tend to develop in somebody who's diabetic would be more on extremities, where blood circulation tends to be a little less efficient. So, if you are working on fingers, and especially toes and lower limbs, where, blood tends to pool more, then we have to talk about, no keeping on sweaty socks, for example, or constricted clothing, or definitely no exercise and working out and things that might be getting bacteria in the area post treatment. So all of these things where most of the time people can get away with, as we know. But in some of these cases, if somebody is healing compromised, it's so important that they really kind of stick to these rules.
Oh, yeah. I mean, I tell my clients that do have compromised healing. And this actually is a thing that I say to everybody, that post electrolysis and laser hair removal, to be honest, limit friction in an area. So friction-based activities, whether that's spin class or hiking a mountain or, I don't know, rowing.
I had one go horseback riding once
Oh,
after a Brazilian. So sometimes, you wonder. I mean, she learned her lesson real quick, and I don't think that it has anything to do with the actual friction, but a lot to do with the bouncing after
yeah.
a Brazilian. I think that was painful.
Oh my gosh. Well, do you remember a couple years ago, Renee, who just got the gold probe this year?
Yes.
She was doing a was it a contraindication class? I think it was contraindication.
Yes.
And she talked about, she did a service, I think it was a bikini wax. And then the person went into the river and was like, well, that's why I did it. Like, and it was like, there's so much in water that is really not safe. And your local river, lake, open body of water is not a conducive space to.
You need intact skin for those. Just go in with all the barriers intact, because there's lots of critters in there.
Oh yeah. I remember her saying that, and I was just like, my skin just kind of like immediately wanted to just like close up and have zero pores, because I just thought that was very disgusting. So it definitely is important.
It's not an ideal.
There for the member that asked about the diabetes question, I think that another great thing is like having good post-recovery cream for them to go home with. Don't say, hey, when you leave, stop by Walgreens or Rite Aid or CVS or whomever your Publix person is, right? You need to go and tell them, like, this is the product I am giving you, and I would like you to use this for the next blank amount of days. It doesn't have to be something that you sell them, but it could be something that you easily upsell if you wanted to. We at the school, we use Calmaseptine, especially whenever we're doing Brazilian work, because it's a zinc-based cream that's very much there to help with like friction-based irritation. And it's meant for like when people have like fistulas and that kind of stuff. And it's a medical grade Desitin. It works as a great barrier. And that's something that is easy for me to give to them, that I know will help them with any rapid recovery, especially when somebody's new to electrolysis, because you're going to find that you have less days where you're 100% in that follicle. It's important to just utilize a cream like that. And that Calmaseptine cream, you can get it from like McKesson is where I get it from. You can get it from Amazon. They have sample size packets. The sample size will last them easily multiple days post treatment, and it's a single use, but like you can give them a Ziploc bag, and you can do large size. I mean, like a tube of it is $7 at Walgreens, but I buy them by the single use packets on Amazon, and so that's what I'm trying to find you real quick, is the grab and go.
How do you spell the product name?
Calm, CALMOSEPTINE. And let me just get to this. There's their website. Found it. But going into the chat now, their website's calmaseptineointment.com. I mean, you could make it any easier. But that is kind of my go-to outside of like Easy Balm and Sensibilis. Those are the two products from Aesthetic Systems and from Zapmaster. Those, you'll see me buying those all the time. I would say that those are great as a quick recovery, but if you're doing more heavy duty treatment, a little bit more barrier is a benefit.
Mm-hmm.
So
Very nice.
is my opinion.
Okay. The next question we had that was submitted was more about snapping and kind of like displacement a little bit. So this would be a thermolysis specific question. When inserting using 2 pulse, and you hear a snap at the bottom, the first pulse, and not on the second pulse, which is on top, or flip that. You insert, there's no snap at the bottom, and then there's going to be a snap at the top. Why the difference? And what does the snap mean when you're doing displacement? And why is there not 2 snaps?
Well, I mean, steam, my friend.
Well, yeah, exactly. Start by, so what she's experiencing with the snap is what we call blowout.
Yeah.
And so a blowout is essentially when you're heating up the water content in the follicle so fast that it actually creates steam, and the steam just kind of goes in the follicle. Exactly. So it's a little snap. So that usually happens because time and intensity, usually intensity is too high. And if it happens when you're moving out, it's because you're reducing surface area on your probe, concentrating the energy even more. And so that's coming out a little bit more intense. The higher you are in the follicle, the less surface area you have. So the more chances of curing that snap you have.
Mm-hmm. When it comes to displacement, in the world of blend, we see this a lot less because the intensity tends to be substantially lower when you're doing blend, because you're only utilizing the thermolysis to aid in the production of your galvanic current into that lye expansion. But it still can happen. And one of the things that I like to think about when you are experiencing that snapping is, one, what were you experiencing initially to set those levels, those parameters a little bit more askew? So if you think about your intensity being quite high and your timing being quite low, why did you choose those balanced energies when you started the treatment? Because if you are going about this as finding a working point, so coming up into the energy, you should rarely see the snap happen, whether it is thermolysis only or blend in that space. And that's because you've worked up into that zone. But if you are kind of going in there and you're like, I'm just going to hit a preset, and I did a quick assessment of the skin, but not necessarily like a full, hydration ratios and that kind of stuff really looked at, then you're going to have more of that happening, usually at the start of a treatment, because you're trying to, you went too far and now you're having to pull yourself back. There's a fun little experiment to do when you feel like this, which is going over to your stove and getting a plain pan in that and warming it up, put nothing in it, and then just pour a cup of water in. And that same that you hear is exactly what you're experiencing during your session. And so if you are trying to kind of get an idea of what that distribution of energy and timing in that space, you wouldn't have that if you had a little bit of water and you brought the heat up to that working point, but you do have it when you just throw heat onto a moist surface, or vice versa.
Exactly.
See here, we got some other questions. We have one person that is struggling to get in, keep hitting yes. Oh, there we go. So we had displacement. Oh, just so everybody knows, I'm a big fan of displacement. And you'll see my probe moving around a follicle all the time because I like to go in there and agitate on top of my energy already. But I think that's just because it was like initially something that I enjoyed doing, like stirring the pot when I was working. I don't necessarily stir the pot like that any longer. I just kind of like move back and forth. But absolutely early on in my career, I was like in there with my filament, just like moving it. I'm like, I'm going to hit every edge of the bottom of that follicle. I've learned that I didn't have to do it the same way. I just had to find my working points.
And that's only really relevant if you're doing galvanic, because moving in the follicle like that, unless you're delivering pulses at the same time, the pulse is already gone by the time you're moving around. There is no point in going in circles and doing all this stuff unless you're delivering different pulses in those areas.
Yeah, that was, I mean, I started off as heavily as a blend operator. And so it was very common for me to do that. But I think of myself as like a little witch, like in my little cauldron. I was like in there just ooving it every
I
time.
mean, I see what you were doing, like I always kind of picture that follicle as a 3D 3D diagram, I guess. And so you've got quadrants, the probe only really is on one side of the hair follicle, and even that, like one quadrant really.
Yeah,
So you want to get around that follicle as much as around the hair, I guess, because the hair's taking up space. So you want to move
yeah.
around as much as possible.
That's exactly, my brain was like, well, how do I know
Hmm.
exactly where my stem cell is in that moment? Like, am I hitting the right zone? And that's like, you know, younger version of me, uh, overthinking things probably. But I, okay, I know that a lot of you are new zappers, um, but we have some established ones in here as well. Um, this is just a funny little moment to think about, but how many of you had bizarre electrology dreams when you were going to school for electrolysis? Because I will tell you, I nightmared about being inside the follicle while it was getting
Yes.
zapped.
Were you being chased by the probe around the hair?
I was definitely not safe. And I think about those things. And I wonder how many of you, I mean, I don't know about you guys, but those beeps from our machine, they sometimes are phantom in when I'm home. But there were definitely things that I recognized early on in my career where they were more prevalent. And a lot of it had to do with like the auditory stuff or like, what am I actually doing inside the follicle? And then my brain was like, let's make up a whole storyline. So,
Clearing an area and then you wipe away and it's all back. Just keep
oh,
going. Like,
that
why
gave
would
me
we go?
Yashiva. Like, I know. Oh gosh. So if you have a funny one that was like your nightmare story, you definitely have to put that in the chat because I need
Yeah.
to know that I'm not the only weird zapper. And I know I'm not because I see your smiles right now on the screen. So that's a big thing. Giovanni, we had a couple of those other questions that we popped into our notes section. Hold on one second. So uh, I know that we talked about the diabetes side of things, but what about the question was about like rosacea and eczema and
Mhm.
psoriasis. Um, how do you navigate uh, working with patients with all of those primary skin conditions? And I would say like with the pacemaker and the cochlear implant, deep brain stimulator, all of the inner medical devices, it can be a separate conversation with this, but
Sure.
definitely.
I think that you have to separate the contraindications, like how they would be an issue. So we talked about diabetes and I group that under healing compromised. And
Mm,
so if any other contraindication, disease disorder, whatever else that would be an issue because of healing kind of falls under the same umbrella in my head.
yeah.
And then we have some that might be like, um, what's the word I'm looking for? So healing compromised, and then it could be that the issue is with, a certain type of current. It could be that the issue is due to reactivity, photosensitivity.
Mhm.
So you kind of want to look at, and sometimes it's difficult, right? People, how often do you get like, what's a full list of contraindications? It's like, well, how much time do you have? Because the truth is like, it could be endless and you're not going to know them all. That's
Yeah.
impossible. So it's better for you to sometimes in general kind of look up whatever is on the medical chart and then think about putting it in some sort of category as to how it affects treatment.
I 100% am right there with you because one of the things I think about when I'm taking in an intake form for for a patient coming in is how what is happening within the body that I need to make a consideration on the flip side because, and this is the biggest part about electrolysis contraindications, there is I should say not so little, there is no current studies of contraindications in electrolysis within current medical devices on the market.
Mhm.
And so everything that we do has to be informed consent, right? Let them know what they're going to be experiencing, what the megahertz are going to be that they're working within, what the modalities that you might be working within as well. And in those same spaces, then have them take that information to their doctor and have a medical conversation that's outside of my scope in regards to what is the comfort level of their provider. When I think about rosacea, I think about how much am I going to irritate your skin to give you an inflammation point where it's going to get worse? Or eczema, how long is that going to take to heal? Or psoriasis, same deal. Those are conversations that I'm having not only with the patient, but I need the patient to go and talk to their provider, their doctor about that, so that everybody is on the same page, because their medical provider might have something that they would feel more comfortable with them using post-electrolysis treatments so they can still continue on. When it comes to like the pregnancy side of things or the intermedical devices, that is a little bit different, because when I think about intermedical devices, I'm thinking about how does RF energy impact whatever device you're using in that time frame, and then we move forward that way. Now,
what's funny is that I just recently, and I actually pulled it up so that I can talk about it. I had a client recently come in with a doctor's note saying that they were cleared for the thermolysis, which, we've always said that thermolysis is perfectly safe, but we also sometimes do high frequency, the Tesla high frequency, so that glass wand as a post-treatment. And so she was concerned about how safe is that to do. And so I, of course, deep dived into it. And I was like, let me give you, in my head, it's fine. Right. But that's not enough of an answer sometimes. And so I was like, okay, let me find out exactly why it would be contraindicated. And then let's talk about how what I'm doing doesn't apply. Right. So I looked it up. And so the concern is usually due to radiation. So duration of exposure would matter, as well as the type of high frequency. So do electrolysis machines produce enough radiation to be potentially dangerous to a fetus, for example, or the Tesla high frequency machine, for example? Then it's about thermal heating of the fetus. So high frequency at certain wavelengths can cook things. Think of a microwave, right? That's what it does. And so this thermolysis also does it in the follicle, but it's very localized, right?
yes.
So is there any concerns about it reaching so far that you're actually cooking the fetus? No way, right? And then the last one was about photosensitivity of the skin, which is heightened when a person is pregnant due to hormones. And so there I was like, okay, this is interesting. So because hormones can make your skin more photosensitive, and we are doing a thermal treatment to a certain extent, now they're becoming hypersensitive, right? So that's not like a reason to turn somebody away, but now it becomes a be cautious issue. Because if you do, let's say, maybe they used to be able to handle an hour on their face, and then maybe because of the hormones and the photosensitivity, maybe now they're not, their skin won't react the same way.
Today's episode of Electrolysis Unplugged is brought to you by Instantronics, the trusted name in high-quality, reliable epilators built for precision and durability. For decades, Instantronics has supported electrologists with machines designed to meet the unique needs of permanent hair removal professionals. Learn more and explore their full line of epilators at instantronics.com.
I gotta read that. I'm so excited that you found that, because that is really cool. I think that it's really important for us to understand that, like, we aren't testing things usually on a person ever.
No.
Especially when it comes to the world of electrolysis, because you think about many of our patients have been struggling to conceive in the first place, and the hirsutism kind of was like that precursor. And so why would we take the extra risks?
Yeah, and I told her too, I said, listen, if the idea of getting, and she was perfectly okay with the actual electrolysis portion. It was like the aftercare that she was concerned about. And I said, listen, that's an easy answer. If you're concerned at all and it's stressing you out, then we don't do it. That's it. A little lotion, you go home, because the truth is like, I'm more concerned about the stress induced by, anything and the effect that might have on the pregnant person versus, like, doesn't matter if if we do the aftercare or not, or all this stuff. No, so that's always kind of what I default to. And even if somebody, let's say, is concerned about the actual electrolysis, I said, if it's enough of a concern for you that it's stressing you out to come in and get the treatments done, then we just continue. We'll pick back up later. It's that, and that's okay.
That's actually part that pops off there for me is that if we are working on a pregnant person, I also want to kind of make them aware that a lot of the growth that you're experiencing could very well dissipate once your hormones level after having the baby. Mm-hmm. And it's frustrating for me to think that I might be the person that's making you spend money on a very temporary problem. And so I am totally down if you have unlimited funds and you're like, oh, I don't care, let's do this. Then let's go, right? I'm fine with that. But I do think about the fact that if I'm going to be chasing hair growth, we have got to talk about the expectations that are being set in that time frame. Because that is a secondary part of working with someone who's pregnant, because chasing that growth is painful business for both parties involved. So there was the last part about this was the medical devices. Most medical devices with modern electrology machines are a non-issue.
Yeah.
That being said, when I say most and modern, I do mean modern in the last 10 to 15 years max. And that is more along the lines of when we think about computers and we think about medical devices, so much changes in a short period of time. Think about your cell phone and how often you have to do an updating your cell phone, right? And a lot of these devices are now app capable, just like the Dexcom, right? That's an app used insulin detector, right? Well, it is so new that we don't really know much about it. And so therefore, it would never be studied in this space. So you have to do that pause and think about what you need to be doing going forward. And then you can keep going, but you'd need to know what that looks like.
No, for sure. And sometimes it also comes down to what materials things are made out of, and they've changed that over time. Some things used to be made out of certain metals, and then they switch over to an aluminum, which does not, cause the interference like we used to have. And so it really depends. That being said, anytime you have a client with some sort of medical device, especially if it's life sustaining, we pacemakers and things like that, you want to make sure that you cover your bases. And so it's one of those things, even if you know that it's probably okay, you just go and have them get a doctor's okay with this. And then that being said, sometimes clients have come back and they said, my doctor won't clear me for it. And I said, well, then it is what it is, but at the very least, we didn't do something that, could potentially come back to you. Maybe the glitch would have nothing to do with you, but who knows, now you became kind of a prime candidate. And then if the doctor was like, well, you did this and that was, I never cleared you for that, then it becomes a liability. So
one of my new patients, she's an adorable older woman, over 70 years old, now has a defib device. And it is a different type of defib device. It's not the one that's implanted. There's a partial implant, and then there's essentially a beeper, a pager looking device on her hip. And so her doc's like, oh yeah, just turn it off during the session. And then I know, which is just I'm sorry. Okay. Your doc's really okay with you turning off your defibrillator for 15 minutes? We're good. Do I have to do anything extra?
Yeah, right. Be up to date and use CPR.
Yes. But it definitely was a thought that went through my head. I was like,
yeah,
I'm so glad your doctor said that's fine.
That's
but
scary, right?
Yeah. I mean, some docs are like, yeah, no problem. And all I can think is I live in a rural town, and maybe that doctor was like, I mean, it's not as bad as working on the tractor all day or something like that. I just, I don't know.
I don't know.
But she turns it off at the start of treatment, and at the end of treatment, turns it back on. And it's funny to see a little beeper back into my life. A pager. I haven't seen one of those since the early 2000s. But it's exactly what it looks like. So, let's see here.
We can go into some medical considerations. So,
Yes.
like, let's talk about how medications like blood thinners and products that or medications used for acne impact our electrology treatments. So, this is another thing, and it's funny because I talked about this today in class, but you won't know what every medicine is, right? So you can, we have these handy dandy computers now. And so it doesn't take but 2 seconds to Google what a medicine is and what it's used for. And then it kind of helps you to place that, whatever it is that it's used for, place it into one of those categories, right? Healing compromised or extra sensitive or whatever it is, at least you can kind of see how to approach the situation.
Absolutely. I love the fact that our cell phones have turned into little computers, because early on in my career, I would have to go into this binder to look for like the high hyper.
Well, do you remember when Hairtel used to publish the list of medications?
Yes.
So I think
Kim had it.
have one of those. Yeah.
Kim from Canada, she is the COPE president up in Canada, British Columbia. She had a fantastic list of hirsutism causing. Hirsutism and hypertrichosis causing medications list. And I was like, that's fantastic. We have not seen that in a while. And we need lists like that. But
they change a lot too. And so,
yeah,
it's hard to maintain.
Absolutely.
And again, tiny computer, you can look it up.
Yeah. That little tiny computer is my best friend, between medication lookups to random music we have to listen to in the treatment room. It's all good.
So let's say you have a medicine that is a blood thinner. So let's talk a little bit about, like, what does that mean for us, right? What kind of considerations?
I mean, one of the big considerations that I think about is slow your roll. Do not slow yourself down as a technician on the side of blood thinners when it comes to possibilities of bruising. We need to think about the fact that, like, one, we shouldn't really see it to begin with. But when someone's asking if we're asking that for bruising, of course, bruising is a possibility, but you should be slowing yourself down to the point where that is not an issue. And that patient should understand that, like, there are certain areas that are no talking zones when you're working. Because that's the biggest issue with blood thinners. I also think about prolonged redness in that area as well when someone's on a blood thinner, because they will look more flush, like blushed, I should say, after treatments a lot of times with blood thinners. Those are the two things that come to my mind at the top.
Yeah, no, I agree. I mean, usually blood thinners and bruising is kind of the biggest thing. Mm-hmm. We shouldn't be causing bruises, but it's a lot easier to do so if somebody's on a blood thinner, for sure.
Oh, yeah.
And acne meds. Go ahead.
Yes, acne medications. They're so drying.
Yeah.
In most cases.
And you see those on everybody's, like, anybody who's, I guess everybody now, just there's always like spironolactone, and then you have some tretinoin, and you have, they go to see a derm for, one tiny pimple, and then they come back with this laundry list of stuff. Everybody's got something for acne. So we see it a lot.
I've even seen, like, people try to utilize antibiotics in those spaces. And I mean, here's the deal. In our industry, we don't talk about hyperpigmentation and hypopigmentation like they do with laser. And the reason that we don't is because the laser spot size, and I have a pen next to me. So you guys, if you can't see me, we have like a big thick dot on one side, and then we have a little pinpoint on the other. So like a ballpoint versus a big old Sharpie. And those two items, when we think about this, the amount of heat that is traveling up the tissue when we are cauterizing a hair, the stem cells within that hair, is vastly different between those two spot sizes.
Mm-hmm.
But they both cause heat and they both cause irritation. And that means that they both can cause hyper and hypopigmentation. So back in early on in my career, when there was a lot of conversations between the electrology community and the laser community, and then you had me in the middle, trying to act like Switzerland. But the fact is like both have the same possibilities of post-treatment outcome being negative, but the amount of area impacted in a laser treatment in a 15-minute segment is so much greater because the spot size versus a 15-minute segment in electrolysis. So if you say, oh, laser can cause hyper and hypopigmentation, you have to remember so can electrolysis, especially when they're on antibiotics, especially when they're on acne medications, because their body is trying to heal in those spaces. So it's really important to kind of take that out of the dialogue of like, oh, this is one thing that could happen with laser, and this is one thing that happened with electrolysis. They both can happen, but how much are you willing to irritate the skin?
Well, and then it goes back to our contraindications. When we're putting things under photosensitive or reactive, then we're dealing with that possible side effect. So, like, why does it matter that somebody has eczema? Well, if they have eczema, their skin is super reactive, super sensitive, and then you risk causing aggravated skin reactions like hyperpigmentation or persistent erythema, even post-treatment, so you just have to be more careful in these situations. That's the reason.
That is a great little sub moment. When we talk about like erythema, our patients, we need to start utilizing medical terminology with street terminology together when we're putting them on the intake forms. Because many people don't know what it is. And so where we might have a chart saying that they had certain post-treatment reactions that are more clinical, if they ever asked to look at that, they would want to know what that means. And so we have to start educating them. Oh, the street term for this is, and then give them that opportunity, because that's going to help them be a more informed consumer and stop feeling like they have no control in the process of electrolysis. Educated consumers make for happy patients, usually. I mean, sometimes it can make for a more frustrated one because all of a sudden they went down the rabbit hole of YouTube.
And then they try to tell you how to do your job.
Oh, yeah, that's not my favorite. We love that for no one.
Yes.
It is. I'm like, oh, friend, I went to school for a long time to do this. And a lot of continued education. That's actually, I don't know about you, but being an educator, and I'm sure Anita, and then is Michaela here? No, she's not tonight. Sometimes, and a couple of my students are on here, so this kind of makes me laugh. Sometimes we'll be talking when they're like, "Oh, is this normal? Is that normal?" That kind of moment, and it's so funny because all of a sudden these patients will start like taking that information as if they were also taking the class, but they had none of the other background. So we want them to definitely be informed, but we also want them to understand that there's going to be a lot more that they don't know. So when you hear an instruction on the floor, it does not, you know what I'm talking about.
Well, sometimes at the school, and this happens, it's like because the models have been around and they've heard us teach the students so much, they start to tell the students what to do. And that is annoying, like how to position, what probe they should take, what modality was done before, and that works. And so that's what you need to do. And, blah, 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 blah.
Mm-hmm.
That sometimes
gets we missed this earlier, but Sue said, where do I go to post questions? So there's two different places. You can drop them in our email. So info@electrologycoalition.com. And then the other one is within your member dashboard. There is a question section in there, like where you can post it and it will give it to us there. So it depends on which one's easier for you. I would say that probably the easiest is email, because we get that immediately, where the other one we have to go log in and go find it. So
it actually sends us a copy.
Oh, does it? I have.
Also.
Are you just like answering it quicker than I can get to it?
I usually put it right in the folder for mentorship hour, so I know where to have it.
You are like,
I'm on it.
yeah, way faster than me on that one.
This season, Electrolysis Unplugged is spotlighting our groundbreaking research project. We're working on bringing legitimacy, data, and recognition back to electrology. If you're a practitioner ready to contribute detailed charting and client outcomes, or a student interested in learning the process, visit electrologycoalition.com. Look under research and get involved today. Together, we're writing the future of electrolysis.
Okay, so we had the medication contraindications. If you came across somebody that was having a lot of irritation, what is your go-to first step in getting yourself out of that sticky situation? Like, you saw some adverse reaction on their skin. What's going to be your first thing that you're going to be like self-assessment? Like, what do I need to do differently? What's the first thing that pops into your head?
Well, usually it's kind of like we talk about what happened and then we just adjust for the next session. I sometimes these aggravated skin reactions happen and, it's rarely going to be something that is permanent. So most of the time when something like this and they come back and I'm like, yeah, that was probably, we did a little too much. Your skin's too sensitive for that. We're going to need to dial it back. Actually, case in point, I have a client who was super reactive on her chin and upper lip. And so the few times, and I didn't know this until a couple sessions in, but she would get full-blown cold sores, canker sore outbreak after I would work on her upper lip and her chin. And so I didn't know until like it was the third time in and she's like, well, we're going to have to pause on this area. And then she tells me why. And I'm just like, I wish you'd have told me before. But it was one of those that like she just couldn't handle even 30 minutes on the lip and it would just be, just a mess. And inside the mouth, like it was bad. So a case like that, I kind of told her, okay, that's fine. We're going to take a break on it. We were doing a bunch of other stuff anyway. And so I said, when you're ready to try it again, you're going to need to be taking an antiviral before you come in. Now, there's a couple things that happen here. You can't take an antiviral every single week and then do weekly appointments. And so obviously we have to do the treatment planning a little different for her face. And so I was like at most once a month because I don't want to like tax your liver and, your kidneys as you're taking all these medicines, which are pretty hefty medicines. But if she wants to do her face, she's going to need to medicate for it because it's going to suppress the virus and then we'll be able to do the session. She'll be able to heal normally. Inflammation will go down and then she'll be okay. Most of the time I could maybe get like 2 or 3 hairs without triggering the virus, but she was very reactive on that front. So that was actually one of the worst cases, I think, for this that I had encountered. So it's kind of like you shift, you adapt.
Yeah. That's exactly what you have to do is like you come across something that's like had an adverse reaction and like in that moment, one, don't panic. Okay. Cause in most cases, what you've done is going to recover, to 100%, if not like 99%, right? Mm-hmm. In most cases. And I would even say that skin is incredibly intelligent in its healing process. And then in a lot of cases, as long as you have not done substantial like burn damage, you're going to get rejuvenation to 100% in time.
Can we state too that you would know at the time of session what you do too much damage that would cause scarring? So I feel like these are things that you would see. Sometimes like these aggravated skin reactions are not obvious at the time of session. It's almost like that it's not healing well because it's the after that is kind of inflamed for too long, redness for too long, swelling for too long. But during the session, everything looked okay.
Yeah.
But when you're working and there's blanching and there's, explosions on the skin and blistering and seepage, hardening of the tissues, like all these things that are just like red flags, overtreatment, this as you're working, if you know what to look for.
Absolutely. And that's actually one of the conversations, and I'm not going to post the picture here just because it's in a case right now for one of the people I'm working to help them out of a sticky situation. But there was a burn case that happened in our area that I've talked about in the past. And the pictures that were shown to us were 8 days post-procedure, where it was still yellow and loss of tissue. And we were seeing like deep reddish purple bruises.
I can show a picture of what that looks like, by the way, as you're talking. It's actually going to be from my skin healing talk, which is happening on Sunday. Right?
Yeah.
God, it's going.
Oh my gosh. Wild.
I'm not ready. Okay, so skin healing. So I'll pull that up and then we can definitely see what that looks like.
That's something that you're going to notice right away. It's just, it will not be something that sneaks up on you later. I will say that stuff that can sneak up on you later is like the deeper injuries, where you
like numbness of the nerves, for example.
Yeah, numbness of the nerves. Oh, yeah, that happened to Mike one time on a student work. Yeah,
because you can't tell that.
No, and it's like you can't. It can happen, but it should give correction down the road. When we have volume loss, that's the stuff that we have to really be concerned about. So when I see a patient have an adverse reaction where they have a little bit more inflammation, a little bit more just tender tissue for a longer period of time, then I'm going to adjust my treatments at the next session. If I see that, one, a bruise has happened immediately, whatever we were doing before that bruise happened discontinues. So if that was my client telling a story, that discontinues. If that was me moving really quickly in a spot and then not adjusting myself, because we're human, right? That is the other part. Now, we shouldn't see that, right? We should not be seeing it from our end. And it usually is going to come from your client end when they are more chatty with you in the area where it's difficult to do so. But bruising is going to be one of those ones that shows up immediately. You're going to have to know immediately that there's going to be a correction. Either they're going to have to stop moving their mouth or you have to start focusing your hand placement. Pustules, scabbing, this. When we saw this one pop online, Joanie, you and I both had like just a total sucker punch.
And I mean, like, and when you look at, so this is obviously an extreme case, like 2 days post-treatment, and this is what it looks like. I mean, like, there's, skin missing. It's just, this is not normal. And this would have been so obvious during the actual session.
Mm-hmm. It breaks my heart to know that they got through that much of their face and made adjustments. This is negligence at that point. Now, I know that there are people out there that their clinical endpoint is to give like a light dusting of scabbing, right? Because they know that that person's always going to have this reaction to this modality. And I will say that I will still try to find a way out of that, because even I get pinpoint irritation after electrolysis, but my skin recovers within 48 hours of that. That's way different than these cases that you just saw. So definitely something to pause on when you think, and that red flag, there are going to be moments in your treatment where if you heard it, doing the little sizzle, we don't know if they're still practicing. One of my Zaplings asked that. The one that's, and my Zaplings don't know this, the one that's here in Washington is still practicing. So, which is why yours truly is working so hard to elevate the standards, because the clinician that did that believes that that's endpoint. And I might never be able to get them to believe any other way, because that might have been the way they were taught, and they might look to their trainer as the one and only Wizard of Oz. But the guru. But that's a red flag if I've ever seen one when it comes to it.
That's pretty scary. And I mean, I guess we always come back to like the importance of education. But I mean, if you're on this call, if you're listening to this, later on from the recording, obviously this, you're one of the few that understand how important it is because of, what we do and the type of damage that you can very easily do to skin and tissues. It's important to know what you're doing, to adjust constantly. We've talked about, we're dealing with skin and there's so many variables that go into what we're doing that not every session is going to be perfect. There's sometimes they come back and there was more scabbing than you would like, and the redness lasted longer than you would like. But these should be fairly mild side effects, but, and hopefully at this point, you kind of just, you pivot, you adjust, and then you keep going, right? So it's normal. During the consultation, I always think it's really important to make sure that clients understand that electrolysis does have some side effects. And like you say side effects, always think about the laundry list of like drug side effects, but we're talking about redness, scabbing, these sorts of things that happen post-treatment, and so that might happen, that, pretty much some of them always happen, and they have to know what it is, and they have to be okay with it. And sometimes there's going to be more than others. And so we always can do something, hopefully, to adjust to make it better.
Well, and that's something I think about is like, this is controlled trauma.
Mm-hmm.
I mean, the goal is to control as much trauma as possible. Okay. And if you ever have a moment in your career like this, know that people like Joanie and I are going to look at you and be like, it's okay. And we will cheerlead you outside of that moment and guide you into spaces where you cannot have that happen again, to that level. And that the fact that you said, hey, I know this wasn't what was supposed to happen. And then you ask us, that shows us and every other electrologist around you the integrity of you as a professional. And that's beautiful. And you should be very proud of yourself in those moments, because it is very hard to say, hey, I think I messed up here. Or, hey, how can I help my client not experience what they did? And you guys are here doing that kind of stuff when, like, the tissue healing class that we're doing and the conversations we've had in past classes. The fact that you guys engage like this means that you are moving away from the past traditions of like, zap it until it's dead. I don't care what the tissue looks like.
Mm-hmm.
And that's hard to do because we want to provide quick results, but quick is
not at the what's the word I'm looking for? At the expense of the skin.
Not at the
right?
expense of skin. Yeah.
Yeah.
Yeah. And like, I think back to like when I talked to you guys about my cheetah print across my forehead after having a laser on my forehead. Like, I look at that as like a funny moment in my hair removal history of my own journey. And my forehead is normal-ish, I mean, like, there's no hyperpigmentation there. There's a lot of wrinkles now, but there's no hyperpigmentation. And so for me, I stepped away from a very high school freak out moment, having hyperpigmentation across my forehead, and corrected it very quickly because I followed protocol post when that happened. And so it's going to be you following as a technician. It's going to be your patients following protocol. It's going to be hyper healing the skin. It's going to be basically treating it as if you had an ablative session done and getting as much of that collagen and elastin to be happy again.
Yep.
So that's my sense on that one.
So we can probably finish with some housekeeping since we've got about 5 minutes left. There is a CEU live webinar on Sunday morning, 9 a.m. That is Pacific Standard Time. So just make sure that you check the clock and what that means for wherever you are. It is going to be recorded as usual. That means that it will be released as a home study. So if you are not able to make the live event, you can always get the home study. As members, you already received your discount codes that you will put in at checkout. So make sure that you're putting that in at checkout. Don't forget, so you can get your 10%. That's one of the perks. And so that's kind of like the great part of doing this, right? Or one of them, one of the many.
The PCOS lecture that I forgot to add the certificate of completion to at the end, that is now remedied. And if you weren't able to print off one, understand.
Email. Yeah. Email and we'll tell you how.
Yeah. That was a beautiful oversight of mine.
So we'll have one more lecture scheduled for December, and it's going to be Stephanie's lecture, and that is going to be electrolysis and laser.
Mm-hmm.
So what they are, how to integrate, how to do all of that kind of stuff. So that will be our last one, and then we'll be closing 2024.
It's wild.
I know.
It's
a crazy year.
It was a great year, though. When I think about all that we've accomplished this year as each I'm like, I know that this is like me being like sentimental stuff. But knowing that you guys are enjoying being here in this space and being able to utilize it for picking our brains and bouncing off of each other and telling your stories, it's important because without us talking about it, we are solo practitioners predominantly. And that means you're living on a little island and you got to take that boat to another island every once in a while. So we got you little lighthouse over here and come over to our island anytime.
And so Steph and I right now are currently working on the launch of the research project. And so if you have filled out the survey, the form that we sent out, then know that we're already assigning roles. And so we are going to be emailing those that are going to be, whether you're a researcher, committee member. And so if you were interested and you ignored that email or you don't remember getting that email, I'm going to be sending little reminders because once we're set up, it's not that I'm not going to be taking on new people, but we're going to be, moving along with this project. And so those that replied with their final, yes, I want to be included, those are the ones that filled out the form. Those are the ones that we're going to be, putting into groups and really kind of launching this. And so we've been just working on getting all of our ducks in a row, I guess, and all these forms together. And so committee members are going to be, we're going to be meeting in January and really kind of starting to go through all the protocols that we plan to do. So that's going to be exciting.
I'm very excited. This research project, and we've been talking about this for a long time, and the nerd in me is just very excited for this project. So,
I'm hoping that everything that we do here kind of, I like being able to have plans and look to the future and kind of do different things. And that's what keeps me energized and excited in this field. I've never been the type to do the same thing day in and day out. And so I always said, I teach and I do work on clients, but I could never just do one thing only because I would get bored. So just seeing clients would get kind of repetitive and tedious. And so I've always loved being able to, sometimes I go teach, sometimes I'm at a conference, sometimes I'm doing this. And that's what makes this field so interesting to me. And I'm hoping that actually this and the different things that we offer can maybe, stir up some excitement with the field above and beyond the fulfillment that you get just, helping clients and treating clients and growing your business and everything like that.
When you said that you can't just have one thing, a lot of the people on this call and beyond have said to me, how are you doing all this stuff? And I don't know. It's just how my brain functions. I enjoy it. There are times where I'm like, why did I give myself all this stuff? Right. But predominantly, I love being able to dabble in multiple things because it gets my brain just really working. And it's a good feeling. And seeing that continuous development of who we are is beautiful.
Yeah. No, for sure.
So,
well, we'll see each other next week. Bye, everyone.
Bye, guys.
Contraindications remind us that our work is deeply tied to health and safety. Thank you for engaging in this critical learning.